Yeah.
A hearty good afternoon to everyone, and welcome to a session on preterm babies and its complications. We're glad to have Dr. Alok Gupta among us today to help us understand this topic. Now, in the case of delivering a preterm baby, we will likely need a longer hospital stay in a special care unit in the hospital. Or depending upon how much care a baby requires, a child may be admitted to the NICU. So, a specialized team with training in the care of preterm babies will be available to help care for your newborn child. The doctor is here to help us understand more about preterm birth and its complications. So, feel free to ask questions and clear any doubts. Doctor, you have the stage.
Okay. Thank you, Puneet. Hello. Good afternoon, everyone. My name is Dr. Alok Gupta. I am concerned neonatologist and pediatrician in Apollo Clinic, Noida. Today, we will talk about the preterm birth and its complications. The first, we should know what is preterm baby. Preterm birth basically occurs when the birth of baby occurs less than 37 weeks of gestation is known as preterm birth, also known as premature baby. So, what are the reasons why preterm birth labor happens? Okay, there are multiple reasons for the preterm labor resulting into preterm birth. First is the uh, infection in the uterus. If mother is having infection in the uterus, more likely there is chance of preterm birth. Other reasons are more common reasons are multiple gestation like twins and triplets. Usually they delivered by prematurity. Other regions like bleeding in uterus, uncontrolled diabetes mellitus, and hypertension in the mother that also led to the preterm birth. Sometimes there is premature rupture of membranes that lead to preterm birth, which is quite common in our setting. Now, next question is what kind of problems preterm babies have after the birth? Actually, this problem related to the earlier the baby is delivered, the lesser the weight of the baby, and they are more likely to have the complication of preterm birth. Likely, we can compare the baby of 700 gram and one kg baby. 700 gram baby have more likely to have more complication as compared to the 1 kg baby. Now we have some categories of the premature babies, depending on the age of gestation when they are delivered. uh, if baby is between 34 to 37 weeks of gestation, they are known as late preterm. If baby has less than 28 weeks of gestation, they are known as extreme preterm. So extreme preterm babies have more complication as compared to the late preterm babies. So why there are so much complication in preterm birth? Actually, when baby is in the womb, there continuous development of organ and other body parts in the mother's uterus. If in case of preterm baby delivers prematurely in less than 37 week of gestation, so these babies do not have enough time to develop these organs. So every organ in the body, right from the brain, eyes, heart, lungs, liver, and kidney, they all are premature. And depending on the grades of prematurity, they have different complications. So now we will talk about the what are the common complications this baby have after the birth. First is the maintaining temperature. This baby have very thin skin, so they are not able to maintain body temperature in open environment. So we keep this baby in special incubator inside NICU. Sometimes they also require automatic heaters. Uh, in case of resource limited setting where incubators are well developed and ICU is not available, mother keep the baby by skin to skin contact, thereby maintaining the temperature of the baby. Second common complication is breathing problems. As we know, these babies are having immature and lungs have not fully developed. These babies have need respiratory support in the form of CPAP or mechanical ventilators. Sometimes this baby needs special medicine known as surfactant to expand the lungs. Actually, the premature baby there is some chemical known as surfactant which is normally produced in the term babies, but due to insufficient time in premature baby, this chemical is not secreted. That leads to collapse of the lung. So after delivery of the babies, we give this surfactant artificially through the endotracheal tube, through the trachea. So that helps in expanding the lungs of the baby. Cessation of respiration is quite common in this baby. So we give one medicine known as caffeine, which stimulates the brain of the baby and maintain the breathing pattern of this baby. So surfactant, caffeine, and respiratory support is commonly required in the preterm babies. Third is the heart problems. In heart problems, PDA, known as patent ductal artery, is very common in the preterm babies. PDA, we should know, is a blood vessel that should close after birth of the baby. But in preterm babies, due to early delivery of the babies, this blood vessel may not close and resulting in the patent ductal arterioles known as PDA. That might lead to many problems like trouble breathing, that lead to decreased blood pressure, not we is not able to digest the milk, not able to properly urinate. So we give medication as per the symptom of the baby and as per the degree of the PDA, whether it is small, large, and the medium size. Second complication is infection of the baby. Infection is quite common in this baby because immune system is not well developed, and this baby has very fragile immune system. So this baby is very prone to infection, whether bacterial or fungal. So we keep strict asepsis in our NICU by way of the repeated hand washing. We clean the incubators and the and the warmers 3 times per day, and we maintain the maximum sterile barrier before touching this baby. So strict asepsis of the baby is very important because this infection can occur in any part of body, whether it's brain of the baby, pneumonia. It can occur in the form of pneumonia. It can occur in the form of urine infections that led to the quite long-term complication in this baby. Next complication is in digestive system. In digestive system, you know, this intestine is very fragile. They are not able to digest the formula milk quite commonly. Sometimes the baby does the vomiting. They pass blood in the stool. Their abdomen becomes distended. And sometimes their intestine become gangrenous, known as necrotizing enterocolitis. This is very direct complication in this baby and very common complications. It usually occur a few weeks after the birth, more common in the formula fed babies. Sometimes this gangrene can lead to perforation of the intestine that may lead to the surgery in the intestine of the baby. This NEC also led to the poor mental mental outcome in these preterm babies. Second is the next complication is bleeding in the brain. This brain of the babies are very fragile. Actually the lining of the brain is very known as germinal matrix is very fragile. This baby have developed bleeding after slightest trauma or spontaneously as well. In case of extreme preterm baby, this baby develop bleeding in the brain, known as IVS, intraventricular hemorrhage and intracranial hemorrhage. For this, we usually do the ultrasound of the brain and day 3 of life, again and day 7 of the life. After this, depending on the symptom, we usually do the ultrasound of the baby, of the brain of the baby to detect the bleeding in the baby. Another common complication is jaundice. Usually, jaundice are more common in the babies, but more so in premature babies because their liver is not well developed. So the occurrence of jaundice is more common in these preterm babies as compared to term babies. Treatment is same, phototherapy, and in rare cases we have to change the blood of the baby, known as double volume exchange transfusion, but it is quite less common. And we have actually all the NICUs are very vigilant about this jaundice, so we usually give the phototherapy very liberally to prevent the chances of the double volume exchange transfusion. So, what are the treatments these babies need? Depending upon the how weight of the baby and how premature the baby, this preterm baby require different level of care. This baby usually kept in the special part of the hospital known as NICU. It's known as neonatal intensive care unit, where the babies are kept, where we have all the machines which are required by preterm babies like ventilator, oxygen support, feeding tube, surfactant, phototherapy machines. We have pediatric surgeon on call also. If surgery needed, they also support us. Uh, and we usually perform the skin to skin contact, encourage the mother to do skin to skin contact with the baby to improve the mother and the infant bonding. This is also known as kangaroo mother care, which is helpful in the overall development of the baby, whether it's brain development, eye development, every sensory organ is stimulated by this KMC, and we are very breastfeeding, breast-friendly hospital as well as the KMC-friendly NICU setting, which help in the all over development of the baby. Now, next question comes: will my baby have long-term complication due to preterm prematurity? Again, the answer is how much premature is the baby. Earlier the baby is born, lower is the weight, the higher the chances of the long-term complications. In long-term complications, when we talk about the brain, there is increased chance of cerebral palsy. That is known as problem in the movement of the balance of the baby. If baby have infection in the brain known as meningitis, this baby develop the cerebral palsy. That is, this baby have delayed motor milestone. Their babies may not walk properly. Their baby may not speak properly if this cerebral palsy develops. Second is visual problems, vision problems. This is more common when baby is less than 30-week duration. This baby have nearsightedness as well as farsightedness. So we have the regularly examine the baby eyes, known as the ROP screening, retinopathy of premature screening. Every 3 week, ophthalmologist comes and see the retina of the baby to prevent this direct complication. Sometimes baby may become blind also if this retinal detachment is not detected early. So we regularly check the eye of the baby regularly depending upon the requirement. Third is the brain problems. Since premature babies are usually having the learning disorder like ADHD, attention deficit hyperactivity disorder, as well as other memory deficit as well. If we caught early, then we can tackle the problem in very well way. Then growth problems. These babies usually have the decreased height and decreased weight as compared to the term babies little life. Then ongoing health issues may like this baby becomes sick more often as compared to term baby. This baby usually have more episode of cough, cold, fever, loose stools more commonly as compared to normal babies. We promote this baby development known as developmental supportive care, in which we keep the baby inside the NICU. We promote the touch of the baby with the mother. We promote the KMC. In that, we will promote the skin to skin contact with the mother. We promote the breastfeeding of the baby, which is very easy to digest for this preterm baby to prevent the NEC, that is necrotizing enterocolitis. In our setup, we are managed to save babies as low as 500 grams, and with the minimum long-term complications. We are regularly treating such babies, and our NICU is well equipped to tackle such extreme premature babies. Thank you. If any question, I am happy to answer. Is there any questions? Thank you. There is no question. Thank you.